I myself, Dr. Abhishek from Natural Remedies, I welcome all the veterinarians, dairy farmers, and animal health professionals. So the today's topic is mastering mastitis. What is essential prevention strategies for dairy farmers? For that, we have a renowned speaker, Mr. William Smits. So Mr. William has been working as a private advisor on milk quality and mastitis prevention topics. He has been an advocate for sustainable dairy practices and better cow welfare. He has previously working at D level for 28 years from 1996 to 2024 in the latest role as a Asia and Pacific milk quality and mastitis prevention expert. He has been worked as a former farm management advisory team leader, and he has been a former managing director D level. Also, he has worked as a farm manager on several large dairy farms in the Middle East from 1986 to 1996. So I request Mr. William to take us forward and conduct the seminar.
Okay, good evening. I think if
I'll stop.
you stop
Yeah.
sharing, it's correct,
Yes.
and
Yes.
share again. Please confirm it's okay.
It's perfect.
Okay, so yeah, welcome to this webinar. Actually, they are two small presentations of half an hour, and I combine them together. So it's going to be 1 hour, and if I talk really fast, it can be faster. Let me introduce myself a little bit, looking at the history of dairy farming and the history of milking cows. So when I was born on a dairy farm, my father, he went to the, I have pictures of grandfather going to the cows in the fields with a horse and a cart, and then the tractor and a cart, milking cows in the field in the summer, and milking cows in the barn in the winter. Then very soon we started with milking parlors, and the first parlors, they had recorder jars. You still see them, but newly I don't think that they are still installed so many. Then I've seen parallel milking parlors, and then we moved to rotary milking parlors. Then those big parlors, they come from China. I worked with turnkey projects. And that farm that you see in the desert is actually in China, but it's a farming group that is driven by expertise from, I think, Singapore and Australia. They're doing farms with 5,000-6,000 cows, producing over 40 kilo milk. And this was one of the farms that we worked very closely with a number of experts. And we realized, I don't want to say eradicate, but we managed to get this mastitis cases below 0.5% per month. Very, very low cases. And we managed to get the somatic cell count to the 73,000 cells per milliliter. Really, really good results. And once we reach that level, we managed to replicate that to other farms, taking the knowledge, training other people. We have been able to replicate that farm by farm. So now I can tell you confidently that mastitis is preventable. I've also worked in New Zealand and Australia with very, very old, I would almost say antique rotary milking systems. I've also worked with robotics, which is coming up more and more in Europe. And don't believe that the robot is going to solve all your problems. These robotic farms have exactly the same problems with mastitis as all of the other farms in the world. There has to be hygiene. The robot has to be cleaned internally, externally. There is manual work as well. It is not fully automatically cleaned. The same problem exists. Of course, bucket milking, I work with that as well. We do them today mostly in a hospital, but a lot of farms, if you look at India or other parts of the world, they still milk mainly with buckets and just moving into the parlors. I come from Europe. Wherever this comes from my pictures in the phone. So wherever I take pictures, the phone stores the location. So you can see that I've been on a lot, and they're all farm visits. You can see that I work quite a bit in India. In the center, we had an office in Pune, Mumbai. I've been in several areas, mostly Southeast Asia, Australia. So I've seen all the different farming types, from the cows grazing, from the small farms, from the large farms in the desert to the large farms in the snowy areas in Mongolia. Interesting, but the thing in common is that they are the same cows and the same problems. And what I do in the farms, every farm, I bring light, I bring my phone, and I take pictures of T10s. And I tell you, initially it was very, very rare to find good T10s that close directly. Mostly farms have open T10s, and with open T10s, the risk to have a mastitis infection is 4, 5, 6 times higher. So this is what we are focusing on. So what is mastitis? 2 slides. This is the bacteria point of view. Say the bacteria, they enter through the T10. So number 1, you need to have bacteria. Number 2, the T10 needs to be open. Number 3, there is time needed. The bacteria, most of the time when they enter the teeth canal, do not cause mastitis today or tomorrow. Often the bacteria, we know that they enter in the cow during the calving period, but it creates mastitis 1, 2, 3, 4 weeks later. So there is a time that they are in the cow, they are there, but they don't develop that infection. It comes later. Only once they reach the alveoli, when they are in that milk-producing tissue, and when the bacteria can form a colony, that they can have a large number of bacteria growing together, then we can say, okay, now we have mastitis. And then the milks, of course, get affected, and then the cow starts to respond. So we have invasion, migration, infection, and it's not all on the same day. From the cow's perspective, it works the other way around. So first, the bacteria, they enter. Already when there is pathogens, foreign bacteria in the udder, at some stage, the cow's immune system gets activated. If you have a healthy cow, this can be very fast. If you have a cow that is stressed, this can take a lot of time. And that often is the difference between a healthy and a strong and resilient cow and a cow that is under stress. It is the speed of this immune system activation. Then we get the response, we get milk composition changes by the mastitis and by the cow, and tissue damage. We'll go a little bit more in detail of each of those steps. So we talked about this, the invasion happened several days or weeks before any signs of elevated somatic cells. And even sometimes if you have the elevated somatic cells, there is no signs of mastitis. We have equipment where we are measuring the cow somatic cells every day. And often you see spikes in the somatic cells, but when we go and check the cow, there is no mastitis. It's just bacteria have entered. The cow has released the somatic cells. The somatic cells have eradicated the invasion, and mastitis did not happen. So not every time when you see somatic cells means that you need to treat the cow. When we talk later about mastitis prevention, we are focusing on minimizing this risk control. Another aspect of this mastitis prevention is nutrition. There is feed additives, and I see in India there is a lot of types of feed additives available. They work in different systems, and that's a separate story again. But with feeding, we can also help to make the cow stronger, and we can help to break this chain. So the pathogens can enter, but then the cow has more strength to get rid of the bacteria before the mastitis enters. Feeding is an important part. So pathogens enter, they're in the teeth canal, they're trying to swim upwards. Then what happens? It's complex. We're talking about epithelial cells, macrophages, it gets detected. And that is like a wake-up call for the cow. Just easy way is just to say this is a wake-up call. And then the speed of this depends on the health and immune status. You cannot say that it's immunity, because immunity you have against something that you know. It is the resilience. It is something that makes the cow respond fast to something strange. Next step, you get the response. The cow is releasing neutrophils. We get the somatic cells. We can get everything thrown up at the bacteria, try to kill the bacteria, try to get rid of that infection. We call this the army. The response. So on one side, you have bacteria. They're growing, they're multiplying. On the other hand, you have the response of the cow trying to control this infection. Then what happens? Yeah, milk changes. Yes or no? Not every time, because if the cow wins, we have a change in milk composition, but we only have elevated somatic cells, and then it will come down again and everything is back to normal. So this is the optimal situation. We have an invasion, you have a cow response, the cow wins. The second option is that the cow loses, but then we get clinical mastitis, what you often see with different streptococcus. Mastitis happens, it becomes clinical, we treat the cow, we detect the cow, we treat it, and problem gets solved too. We lose something and we think this is expensive. No, this is not the problem. The problem is, if you have the bacteria in the cow, we get the mastitis, the cow is fighting, but it does not become clinical. It becomes subclinical. And we don't see it, we don't find it, and we don't treat it. And this is, in some farms, up to 20, 30, 40, 50% of the cows. They are in this group of cows. And this is the most costly part, because you don't want to treat 50% of the cows, but somatic cells is elevated, yield is reduced. And maybe, hopefully, once we dry off the cow when she's pregnant, we can use antibiotics, and then the next year she will start a new lactation. Yeah, fresh, and hopefully without infection. Fourth option is that the cow wins, and we see that in coliform E. coli coliform infections. But the cow responds so aggressively to this coliform bacteria in the quarter that we lose the quarter. It can happen in 1 day, in 2 days, but the cow gets rid of that quarter just to protect herself. So in that case, we also lose a quarter. This is very important. So finding every case of clinical mastitis and treating all of the cases of clinical mastitis will never prevent all mastitis, because there is this group of cows with subclinical mastitis. And nobody agrees on whether you should treat them or not. The best way is to make sure that the cow is strong and that we prevent it from happening, and we bring down the number over time. Long-term result. Every infection destroys milk-producing tissue. It destroys alveoli. When the cow releases millions and millions of somatic cells, milk production tissue is destroyed. The bacteria destroy the tissue. So we are losing protective tissue. What I want you to remember, the cost of mastitis is not the cost of the antibiotic. It is not the cost of the milk that you cannot sell and that you have to discard. It's not the extra time, the effort. It's not the cost of the veterinarian that you have to bring to the farm. The biggest cost of mastitis is the damage that we are doing to the udder. It's the loss of future productivity of the cow. And then often we have to let the cow go. So the cow is not fulfilling her productive lifetime. The cow will not live that long on the farm. So we have those two types, the lifetime of the cow, loss of production capacity. And honestly, the third one is that when a cow has clinical mastitis, also the fertility is affected. So those parts are extremely expensive. but the farmers often are unaware. When you ask what's the cost of mastitis, they say, $20, $30. No, the true cost is somewhere around $400. So, in each farm, there are 5 types of cows, besides dry cows. We have a group of cows, that's the big block, the healthy milking cows. They have always been healthy, or they had mastitis and they have been cured. So we can even split this into groups. Then we have a group of subclinical mastitis cows. That are the cows that are having an elevated somatic cell count or a positive CMT test. And this group of cows, again, we can split in 2 categories. If we do the testing on a monthly basis, whether it's CMT or somatic cell counts, the cows that had a low somatic cell count last month and a high somatic cell count this month, we call them newly infected, recent infections. And there is no, hopefully, maybe, next month they will be cured by themselves if you don't have to treat them these often. There is another group that had a high somatic cell count last month and has a high somatic cell count this month, and commonly we call them chronic cows. They were infected, they're still infected, and these are your very, very dangerous cows, because these can be the Staph aureus, the contagious mastitis, and this can be the infection reservoir within the cows. There are other reservoirs, but yeah, this is the reservoir for contagious mastitis. So we have healthy cows, cured cows, recent infections, chronic infections, and then we have a little group of cows, hopefully very little, that is in the hospital. We call them the clinical cases. What we do in larger farms, when we test every month, and often that gets automated and outsourced to a laboratory, we monitor those 5 groups. And over time, with different trials and tests, we try to increase the percentage of cows that is healthy and cured. And that means that we are trying to reduce the number of cows that has subclinical mastitis. And we are happy if we can bring this from 50, 60%, we can bring the number of healthy cows up to 90%. Because if you do that, I can almost guarantee you that your somatic cell counts will go from 400,000, 300,000 to 200,000 and 100,000. A little bit about losses. There is 2 aspects, and they're happening both at the same time in the farm. So if you have elevated somatic cells, this is the group of cows that is subclinical mastitis, we are losing yield. If we go from 100,000 to 200,000 somatic cells in lactation 1, we lose 100 kilo milk. But if they're older cows, tissue is not produced anymore, then we lose 200 kilo of milk. So preventing mastitis, and you go up 100,000, or you improve by 100,000 somatic cells, you get more milk, and that has been proven over and over again. This is one aspect. The other aspect is the clinical mastitis cases. This is in dollars, but this type of research is done in Europe and in other countries as well. It is always the same. At the moment, we're talking about over $400. And the big blocks that you see, that is the loss of the future production and the early, they say, the shortened productive life of the cow. Now we have to go back. Sorry for that. I had to remember how we do that. So this is a little bit about the basics of mastitis. So you know what is the mastitis. And curing does not work because you can only cure what you can see. You cannot cure the subclinical mastitis cases because it's a very dynamic group of cows. They come and they go. Hopefully you can find out some of the chronic ones and separate them and treat, but these new infections, they come and they go. So by the time you find them, sometimes they have already cured themselves. So prevention. Prevention, and I call it true prevention, is going to the root cause. Root cause, we have bacteria, we have an open teat end. Let's start with that. And another story is we can talk about that maybe in another session, in another time, is why do we have an open teat end? Because it happens, it's related to the milking machine and how do we milk cows. But when we want to talk about mastitis prevention, we need to go to step 1. Don't wait for step number 2 or 3 or 4 when the milk is changed. Prevention starts from the beginning. Preventing bacteria to enter. So the prevention aspect here is, let's start by milking the cows properly. And when I look at machine milking and you look at machine milking, maybe we're looking at different things. I see a lot of errors in machine milking, that we are A, often not taking out all the milk, and B, we are trying to force the milk out by the machine, and it doesn't work that way. If the cow is not giving you the milk voluntarily, the machine cannot extract milk, and we are doing that wrongly. So milking management, training the people that are milking the cows is very, very important because that helps to keep the teat end closed. It's very easy to have a teat end that is closed a few minutes after we remove the milking machine. It doesn't have to take 30 minutes. You don't have to lock up or tie up the cows and to prevent them from resting, as long as you do the milking properly. Milking management and hygiene. So milking management is the teat end, and hygiene is reducing this bacteria number that is around the teat end. The second part is when the bacteria have entered, hopefully if the teat is closed, bacteria will still enter, but they will be very, very small numbers compared to when you have an open teat end. Then we talk about increasing the resistance of the cow. Make sure you have proper nutrition, make sure that the cows are cooled, make sure the cows have minimum stress, and you will see that the number of cows that really get a mastitis infection reduces. This part is nutrition, but also a large part is what we call cow comfort, making sure that the cow has a soft and dry resting place, make sure that she can rest 12 to 14 hours, make sure that there is no competition for feed, no competition for water. A lot of those little details that by the end of the day prevent mastitis. Hygiene. We think hygiene is simple. I broke it that there is hundreds of steps, but generally I look at 4 different aspects. So we're starting where the cows are living. It is a walking area where the cow is walking, and if there is too much manure or the manure is too thin or there is too much water and the cows are walking fast, it splashes, and we get this splashing manure all over the cow. The second part is the resting area. When the cow rests, she should not put her udder and her teeth on the location where she was just standing with her dirty hooves. And here on the picture you see cows resting. They're resting nice and far inside, and the udders are maybe 20, 30 centimeters in front of the end of the stall. That is a space where hopefully the bedding is dry. But if you force the cows to rest in the rear part of the stall, where the cow is just stepping in with dirty hooves, you will also always have mastitis. Second part is the milking area itself. Because in the milking area, we're pre-milking the cows, there is some milk dripping from the milking units. If this is not cleaned really well, not just with the water gun and a little bit of water, but it has to be cleaned really well with water and soap and a brush. If you don't do that, you get biofilms at various locations in that milking area. And I guarantee you, sometimes the milking unit falls on the floor, things happen. Those bacteria, they are not the same bacteria as in the barn. Those bacteria that are in the biofilm in the milking area, based on drip milk, those are the same bacteria that are creating the mastitis. That is your coliform, streptococcus, staphylococcus, and they are already accustomed to living in milk. Those are much more dangerous. So milking area, the milking unit itself. Many milking areas are dark, and if you bring a light and you shine the light on the milking, say the cups that are going to on the cow's teeth, you find those yellow deposits, sometimes not yellow, sometimes they're just slimy. It's not being cleaned properly. And this is very, very common, especially when the farms get larger and there is less time to do these type of things. So all those little details, and these bacteria, again, those are the very dangerous bacteria. And when the worker puts this thing in the hand and then he goes to the teeth to attach the cups, the same hand will touch the teeth to push the teeth into that cup. And he's, if you use iodine and you disinfect the teeth and you bring a clean, sterilized towel to clean the teeth. And then in this step, you destroy all your effort by milking with a dirty cup. Milker hygiene, we say wear gloves. The gloves are not the critical thing. The critical thing in all of those steps is the attitude of hygiene. People have to agree and remember, we do not milk a cow with a dirty machine. We do not milk a cow with wet teeth. We work clean. It's attitude. You cannot hammer all of the details. Details are everywhere. If a unit falls down, you wash it first before you put it back on the cow. There are all those details. A little bit about pictures, more about the barn. If you see cows standing in the stall like this, it means she's going to lay down with the udder very, very, very near to the rear part. And that's where she will step first with her dirty hooves. Those type of things are very, very important. Here there is a slide, and maybe later we will distribute the slides. You can see the dimensions that are needed for Holstein cows. A simple dimension is the diagonal, what we call C, from the neck rail to the rear part where the cow can stand. If you have big cows, and I've seen them in Punjab, you have very big cows, start with 2m15, 2m16. Often it's barely 2 meters. And the cow cannot go inside properly. And if the cow cannot go inside properly and comfortably, she will also rest less. And the udder will be at the wrong location where it is not dry and clean. All of those details are very important. This slide is just for information. There is a lot of scoring. There is cow comfort index. We're looking at which percentage of the cows in the stall is resting and which percentage of the cow is not resting or just perching with 2 feet in the stall. We have the bedding test with the knees to check if your knees will stay dry or if it's soft enough, because if you fall down on your knees and it hurts like hell, then the cow cannot sleep comfortably as well. We have the hock scoring. There should not be the bald spots because they get infected. And surprise, if you have a lot of those infected hocks, you also have more mastitis. Another little tip, take a tissue or cotton swab, and after preparing the cow for milking, before you put the milking unit, swab the teeth end, because the people very good clean the barrel of the teeth, but people are not so good in cleaning the bottom of the teeth. The teeth end is the important part to be cleaned. Using iodine and then not removing it, or not removing the manure from the teeth end, equals no disinfection at all. Teeth end must be dry, teeth end must be clean. This is one of the rules of milking. Okay, a little bit more about teeth ends. There is this myth that the teeth end closes 20 to 30 minutes after milking. And I tell you, if the teeth end is good, and we call that teeth end score 1, it closes almost immediately. If it is score 2, it takes multiple hours to close. If it's score 3 and 4, If you milk the cow in the morning and you come back in the evening, the teat end is still open. It never closes. You can see cows entering the parlor with open teat ends even before we start milking. This is unbelievably important, and it is so sad that so few farmers do teat end scoring and take this quality picture. This is permanent damage, and to recover from this, the cow will need 1 or 2 months just to improve one level of score. A lot of the more short-term damage, but is also very telling, is those red ends at the teeth end, red rings on the teeth base. Those are signs of pain. You try to touch a teeth like this after milking, it's very, very painful. If it's painful for the cow, do you think the cow is releasing you all the milk? Because the cow has a memory. If it's painful today, tomorrow she will not release all the milk, because it's already hurts during the preparation. Does she release all the oxytocin? Is she going to give you all the milk? Yes or no? No, she will not. Milking will be slower. All these things have to be improved. My target is 95% score 1 and 2 on hyperkeratosis score. 95% should be closed or have a very small opening and a very shallow ring. If you have a larger ring and roughness around it, those teeth should be 5%. I know the books that we read, they say we can have 20%, but if you accept 20% score 3 and 4, you accept also 2 or 3% mastitis per month. You also accept 200,000 and up on somatic cells. We can do better. We must do better. The cow. When we do milking, we historically seems to have so much focus on hygiene. We want to do pre-dipping, and then we want to keep the hands clean. We want to do pre-milking, and then later we want to come back to do the wiping. But we forget that the cow has to release the milk. So the rule is always first take care of the needs of the cow. The cow needs at least 10, 15 is better, but at least 10 seconds of continuous stimulation. Stimulation can be achieved by milking or by wiping with the towel. And if you get larger farms and people do the pre-milking fast, they will not give 10 seconds. And when they do the wiping with the towel fast, it will not be 10 seconds. But if you combine the two actions, that you will pre-milk with one hand and you wipe with the clean hand with the towel at one cow, you will get more than 10 seconds stimulation all the time. This is a significant improvement because the cows will release much more oxytocin, and then the milk will be pumped from the cow, from the alveoli into the cistern, into the teeth very rapidly, and the milking machine can extract the milk very fast. I know hygiene is critical, but it's secondary to the milk letdown. We cannot compromise on the milk letdown. So in the green block, the numbers are seconds, are times. But say we pre-dip, and we pre-dip 5 cows, we walk one line. The red is walking, or the green line. We walk back, and we bring towels, and we strip and wipe. We pre-milk, and we clean the teeth. 1 cow, 2 cow, 3 cow, 4 cow, 5 cows. If we take 15 seconds per cow, and we do 5 cows, it takes 75 seconds. And then we walk back, and we start again attaching the milking units from the first cow. It's a simple milking routine, but it follows the basics. We get the correct stimulation, and then we leave the cow alone, and we come back after 60 to 90 seconds, even 120 seconds. We come back and we put the milking unit. This is the only way to milk the cow, so going together with the milk release of the cow. Of course, there is also the milking machine, the cleanliness, the hygiene. To give you an impression of what we achieve, a cow that is doing 10 kilo milk, as average, will milk in 4 minutes, within 4 minutes. 15 kilo milk should be milked within 5 minutes. So you have a cow with 30 kilo milk and you milk twice a day, 15 kilo per session. If you do the timing of a number of those cows, this is what we achieve. Details of this, vacuum levels, when to remove the unit, that's another session for another day. So mastitis prevention is about udder health. And there is only 3 things that you can do on mastitis prevention. 1, hygiene, reduce the number of pathogen in the barn, in the milking area, on the cow. Keep the door closed, focus on the teat end, and focus on the cow health. It's not just nutrition, it's also comfort, stress reduction, everything that is related to making the animal happy. Let's call it that way. Happy cow, happy life. There is more things to do. There is machine, but I think we are running out of time. So let's
No,
stop
we
here.
have time. We have time. We have time.
Yeah, so I think this is the last slide, so I'm good. Yeah, let's stop here. The rest is not that important. I think I covered the important parts. I stopped sharing, sir.
Okay.
Okay, it's gone.
Okay. Yeah. So, like, I got a couple of questions. During monsoon, what should we take care to avoid mastitis? Now, this is monsoon time. So, what are strategies we should adopt?
By any means, you should have the cows clean if you can. But this is not always possible. So if the cows are not clean, we have to wash them with water, right?
Okay. Right.
Now we have a problem because we want to wash them with water, but then the cow has to drip dry. But if I don't start milking within 120 seconds after completing the washing, the oxytocin in the cow start to disappear. And by the time you are at the end of the milking process, the oxytocin is gone, but there is still milk in the cow and we cannot get the milk out. And then what you see is when the cow walks back to the barn, you can still see milk dripping. Even you try it and you push on the machine, you try to get out all the milk, you see the cow 10 minutes later dripping milk out of the udder. It's not a machine problem. It is that you start milking too late. It's very common in farm because they start milking one cow and then they start washing the other cow. But when you wash the cow and you start rubbing with your hand, the cow is releasing the milk. But this milking machine that you need is still on the other cow. It's going to take 5 minutes. After 5 minutes, there is no oxytocin. It's impossible to milk the cow. So the only way to do this, you can soak the cow with water. Don't use a towel, don't use your hand. Just make sure if there is a lot of manure on the udder, for a few seconds, spray water on it. Let it soak, let it be soft. Only when you know that within 120 seconds, I have a milking machine free, I can finish the washing, and then I can bring a towel to dry it off as much as I can, but you must start milking within this 120 seconds.
Okay.
And if you can, and I see that in New Zealand, the cows sometimes are very dirty as well, because it rains. They have a cold and a rainy season, not a warm and a rainy season. They only clean the teeth. They dip the teeth, they only clean the teeth. You don't need to clean the whole udder, because if you make the whole udder wet, you need to dry the whole udder. Try to clean just the teeth and milk just the teeth. It's the best I can do. But it's complex.
Okay,
but you need to remember the rules. The stimulation will be more than sufficient. But your timing that you need to start milking, that is very critical in these type of adverse conditions.
And one more question, that is, how important is the nutrition during treatment of mastitis?
You know, if the mastitis is there, it's too late. It is important to have the nutrition before the mastitis starts. It's still very important. You can still help, but it is too late, because the nutrition, if it's done well, it helps to stop the bacteria from infecting the tissue, from creating the biofilm, which is their fort from where they multiply and colonize the rest of the udder. So once that colony of bacteria is there, you can do what you want with nutrition, but then you need antibiotics as the support therapy.
Okay, we have received one more question. How important is negative decad mineral role in reducing mastitis percentage?
This relates to the whole transition story. So mastitis does not come alone. Mastitis comes with retained placenta. It comes with ketosis. It comes with all of those. It comes with milk fever. It comes with all of the problems that the cow has, because those issues break down the resistance of the cow to a level that she cannot resist bacterial infections of the udder. So if you can, anything you can do to minimize transition problems and help the cow in the startup, whether it's, yeah, this part is very important. Whether you do it
Okay.
with yeah. So in the old days, we just looked at calcium and phosphorus. Today, we look at DCAT and we look at all of those other things as well. It's important. It's very important.
One more question. Which is the feed additive which will limit bacterial infection?
I'm working with something that is called, the active ingredient is called alpha monolaurin.
Alpha molar, okay, acid.
Yeah,
Okay, okay.
it's a product that comes out of coconuts, but coconuts, when you give the oil to the cow or when they get digested, you get monolaurin. You don't get alpha monolaurin, or you get lauric acid. But for humans, there is nutrition additive for humans, and it seems to work very well against throat infections and other things. But for cows, it does not treat mastitis. But it is at doses that I see that it has been tested, it helps to prevent this bacteria to get started with the infection in the udder. So it prevents mastitis, but it does not treat.
Okay. Other than somatic cell count and low milk yield, any other observation we can get in subclinical mastitis?
There is one aspect that is very important on subclinical mastitis, because India is a country of paneer and cheeses. The somatic cells is what we measure in the milk.
Yes.
The protein in the milk is not reduced so much when a cow has high somatic cells, but the composition of the protein is changing. So when a cow has a high somatic cells, when there is an infection, a lot of the protein is what we call whey protein. It's not utilized for making cheese. And the casein, the protein that is needed for the cheese, is much reduced. So you can lose 10-15% of cheese yield, and you get a much less strong curd. So it's very important in cheese manufacturing to have milk with the lower somatic cell count. This has been tested also in India.
Okay. Okay. So that was all the questions we received. So I like to thank everyone, and I like to thank Mr. William for giving such a wonderful insights related to mastitis. And I also thank all the participants who have attended this webinar. So thank you everyone for attending this webinar.
Yep, thanks very much, and let me know if I can be of assistance later on. If
Sure,
you have
sure,
any
sure. I
questions,
will.
yeah, you can also share if any questions come on later.
Sure. Thank you. Thank you so much.
Okay. I will keep the chat open and have a look after a few minutes. Bye-bye.
Yeah, yeah. Bye bye. Bye bye.